Welcome back to Good Things Utah. We're tackling one of those health issues today that maybe you're embarrassed to talk about. Dr. Christopher Canale is here from Utah Gastroenterology, and it's a form of reflux?
Great question. So Barrett's itself is actually caused by reflux. It is one of the risks that we see if patients have long-standing untreated heartburn and reflux symptoms.
It's interesting because I didn't know what this was. So if we don't know what it is, how do we know we have it? What are the symptoms?
It's a great question as well. So the symptoms of actually having Barrett's esophagus. So Barrett's esophagus is where the last portion of your esophagus, where you swallow food and everything, right before where it connects to the stomach.
Yeah.
Instead of looking all pink and smooth like the normal esophageal lining will look, it actually starts looking like kind of crushed red velvet. And it's an actual cellular change of these cells changing to mimic cells of the intestine. And so the actual presence of that crushed red velvet lining doesn't have any symptoms, but what you generally see are the symptoms that lead to this condition, whether that's heartburn, difficulty swallowing, chest pain, a dry cough at night. Those are kind of the hallmarks that you may want to consider talking to your regular doc about getting this evaluated.
Who does this affect?
This affects, that's a great question, men.
Okay.
Men over 50 generally, fatter people, and it actually depends on where you carry your weight. The more your weight is in your belly and not in your limbs, the more likely you will be affected by this. And anybody who has had long-standing heartburn. So it affects men kind of 2 to 1 over females, and it actually has a white predilection. So whites tend to be the most common patients that develop this disease.
I wanted to ask you, excuse me, what is the procedure to fix it or detect it? What do we need to do?
Great. So it's a pretty simple procedure. It's called an endoscopy, and it's an upper endoscopy. We give you some good medications. You go sound asleep. The whole procedure only takes about 10 minutes. And we just sneak a scope down through your mouth, and we take a really good look at the lining of your esophagus, and we look for 2 things. One, to see that it has that kind of crushed red velvet change in the last portion of the esophagus. And 2, we actually need to take biopsies and look under the microscope to see if we confirm those changes of the lining that mimic the small intestinal lining.
All right, guys are notorious for not going to see the doctor.
Correct, and they're
somebody
the
has to
biggest at
shove
risk.
them
But the
into the
interesting
doctor's
thing is,
office.
Nisha, most women who are watching this show right now will be telling their husbands to go and do it.
As they need to.
Yes, it's important. I want to say to you, I want to ask you, I should say, we have it treated, we go out, sorry, we have it detected, we have it treated. What are the symptoms if we don't treat it? Where does it lead to? What are the health implications?
And that's the main concern, is that we know that patients with Barrett's esophagus have an increased risk of developing esophageal cancer over the general population by maybe upwards of 30 times that of the general population.
So this is serious.
This is
something you
esophageal
need to
cancer.
get
So when esophageal cancer is incredibly serious, when you get it, patients die from it. It's not one of those benign indolent cancers.
Is there a genetic component if mom, dad has this?
Possibly. We think that in some families there can be a familial history. We're not sure if that's actually just that they all eat poorly and they have bad lifestyles, and it may not actually be something in the genes that we know.
Will you talk about that for a second, eating, and how what you're eating and what you shouldn't be eating affects this?
We eat a lot of processed food. It's difficult to say if eating more spicy food, carbonated beverages, caffeine, alcohol, smoking per se can cause this, but we certainly know that those are foods that cause more heartburn. We certainly know that patients who have longer standing history of heartburn are much more likely to develop this condition.
And what I love about this, Dr. Christopher, is that it is covered by your health fund if you want to go in and have a checkup.
Absolutely. So if we find that you only need to be screened about every 3 to 5 years, it's a 10-minute procedure and it is covered.
Easy enough. Head to Utah Gastroenterology if you have any more questions. And ladies out there, if you need their help in talking your guy to come in, that's their website. We'll link you from ours. Go to forutah.com/GTU. The doctor is there, everybody there.